Stand by to fall in, Polk County. This is today's veteran. Hello and welcome, and on behalf of everyone at the Office of Polk County Veteran Services, thanks for joining us. I'm your host, Tim Kirkhart, and on this installment of today's Veteran, we chat with Joe Battle, Medical Center Director of the James A. Haley Veterans Hospital and Clinics in Tampa, effective July 26 of 2015. Activated in 1972, the James A. Haley Veterans Hospital provides a full range of patient care services with state-of-the-art technology as well as education and research. Comprehensive health care is provided through primary care, tertiary care, and long-term care in areas of medicine, surgery, psychiatry, physical medicine and rehabilitation, spinal cord, injury, neurology, oncology, dentistry, geriatrics, and extended care. Mr. Battle, welcome to the show.
Thank you so much. It's so good to be here today.
Good. We're just going to ask you some questions and get your thoughts and feelings on the James A. Haley Hospital and Medical Facility. Who is Joe Battle?
Well, Joe Battle is a person who has been in the VA for over 32 years. I consider it a privilege to serve veterans and work for VA. And coming to Haley for me is a very special opportunity, since Haley is one of the larger facilities in the VA system, and being able to be the director here is an honor for me. And I consider it a privilege to serve the veterans. But personally, from Alabama originally. You might hear that in my accent a little bit. Married to the same lady for 35 years, 2 grown children. Been around the VA system. This is my 6th VA hospital in my travels around the country. But glad to be in Florida and happy to serve veterans.
Great, we're glad to have you. We're glad to have you. And you've been here for how long now?
A couple of months.
Okay.
Couple of months.
Tell us what have you seen in the last 2 months at James A. Haley?
Well, I appreciate that. You know, one of the things I see is first, you know, we take care of around 90,000 veterans come through our doors every day. Also, we do active duty military, have a large mission with that, which is unlike many other VAs with the active duty, but I see a lot of people who are dedicated to serving veterans. I also see we have some wonderful spaces. Also see we have some things we can work on too. One of the things at the hospital that I have an interest in is our wards. When people come to the hospital for care, we still have a lot of multiple bed units, 4 bedrooms, 2 bedrooms. And I want to work toward getting private rooms for all our veterans when they come to the hospital. So that's a priority for me, to try to get a bed tower built there to replace the wards. A lot of our clinics around our catchment area need to be bigger to serve more veterans. So I'm very interested in trying to improve our clinics by making them bigger to allow for more care out in the community. So those are some of the things I've seen since I've been there. But overall, a really good hospital.
Good. Of course, we have the CBOC, the community-based outpatient clinic here in Lakeland, which is a satellite of James A. Haley. We have a lot of veterans that go there, and can you tell us, in the short time you've been here, have you looked at the Lakeland CBOC? Can you give us any ideas on if there's any plans there to expand or anything at this point?
Sure. Well, actually, when I leave here, I'm going to the Lakeland CBOC today when I leave this interview. So I'll be heading over there right after this. But the clinic itself right now serves around 1,000 veterans in the clinic. There are about 300 veterans that want to come to the clinic, but due to some space constraints, we haven't been able to accommodate them yet. So one of the things I'm looking at is there a way we can expand that clinic on the short run to create more space where we can bring another panel in with a new provider to be able to accommodate that growth. We also have a doctor there that's on military deployment right now.
Right.
But that's a short-term issue that we'll look to try to improve. But the biggest issue in Lakeland is needing more space to expand. So we're going to see what we can do about that.
That's probably always the big issue, isn't it? Space, and like you were talking about, your thoughts and goals at James A. Haley. And there always seems to be construction. When I go to the James A. Haley, there's always construction, which is good.
That's right. Well, generally healthcare reinvents itself about every 5 years. New ways of delivering healthcare, new procedures, new ways of doing things. So we're always changing the hospital up to improve the way we deliver care there. I don't think that'll ever stop. So that's a good thing. That means we're progressing and trying to give latest technology to our veterans for their care.
I know parking has been a problem in the past.
Yes.
A new parking garage opened a couple years ago. I used to go and park in the outstation and get picked up, which worked well for me. But what is the parking like?
Well, it's a lot better than it was from years ago. This is my second time to work in Florida, so I had been to the hospital before, and I remember where people used to circle around the hospital all the time looking for a place. In the 2 months I've been here looking around, we don't have that issue anymore. I don't see people doing that. Plus, for folks that need extra help, we have valet parking for them and those sorts of things. So I'd have to say, from what I remember before to now, it's much improved.
Me too, from what I remember having to go to the shopping center, but that was always efficient also because they dropped you off right at the front entrance. But
yes, sir.
The last few times I've been there, I go to the parking garage and it seems great. So
good.
Yeah. With your short time here, have you set other goals?
Besides making sure our veterans get good quality health care, we want to make sure that they have amenities that are consummate to them having a good experience. One of the things we don't have in the hospital right now is public Wi-Fi everywhere. So I'm looking to try to get that installed where when people come in, families and visitors and veterans, they'll have public Wi-Fi to use their own personal devices with everywhere. So that's kind of an important thing for me because, for the first time in many years, the average age of our veteran is getting younger. So we need to pay attention to what all generations of veterans need from us and how they want to get their care. So those are things that I pay attention to. Other things we're looking at is we always want to continue to improve our access of care to veterans. And we're always looking to do better with that. So access to care will be something that I'm always paying attention to. We want to make sure veterans get seen when they need to be seen. And when we don't, that's something we need to improve on. Right now, about 96% of all our veterans get their appointments within 30 days of their desired date, but we want to do better than that. So we're going to keep working on that. We need to do better on answering the phone. So I'm working to see how we can make improvements on getting the phone answered and getting people to who they need to speak with in a more efficient manner. So those are some things we're going to be working on right off the bat.
For more information about James A. Haley Veterans Hospital and Clinics in Tampa, look them up on the web at www.tampa.va.gov or give them a call at 813-972-2000. We will continue our conversation with Mr. Battle, Medical Center Director. But now we want to take a look at the 4th Annual Military Order of the Purple Heart Golf Invitational in Lakeland. There were more than 100 registered for the tournament, and the event raised more than $11,000 for the group. Here are the sights and sounds of this year's event.
The Purple Heart is the oldest military decoration. It was originally designed by George Washington, the father of our country, and it was in recognition for people of military merit back in the Revolutionary War. From 1932, Douglas MacArthur changed the medal, making it for all branches of the service as a decoration for people who have been combat wounded. Today's event is our Golf Invitational for the Military Order of Purple Heart. All proceeds that we take in today will go to help veterans in Polk County. We found out this morning that we have doubled the number of entries in our Golf Invitational, and we're doing quite well. What we're doing today, we're going to help the veterans in Polk County with different programs, and we're trying to also help with the Flight to Honor, which is going to be held by Colonel Gary Clark of the Veterans Council in Polk County.
Nice, Rhonda. That might be the ball that we play. Yeah.
This is such a big event, and all Polk County is part of this. We have people from the mayor's office, we have people from the county office. Polk County veterans have been helped by the community since we are Polk County is a Purple Heart city and county. We have everything that we have here is done by our veterans and through our sponsors here. Our sponsors here in Polk County come from all ways and walks of life, and they're here to support their fellow veterans.
Without the sacrifice of the veterans, especially the wounded veterans, those that are still alive and those that have gone before us, without their sacrifice, none of us could do what we do. To get this many people out supporting this foundation is worth my time, my company's money, and our efforts. It's an awesome, awesome event.
Nice shot. A little left though, but nice. Just missed it.
History tells us that a lack of hurricane awareness and preparation are common threads among all major disasters.
By knowing your vulnerability and what actions you should take, you can reduce the effects of a hurricane disaster.
Hurricane hazards come in many forms, and preparation is the best protection against the dangers of a hurricane.
Knowing the difference between threat levels and then planning accordingly can help you in recovery.
This hurricane season, have a plan and get your supplies together, or you can do nothing.
Welcome back to today's Veteran. I'm your host, Tim Kirkhart. Joe Battle, Medical Center Director of the James A. Haley Veterans Hospital and Clinics in Tampa, joins us in studio as we continue our conversation about veterans health care through the James A. Haley Veterans Hospital under the guidance of Mr. Battle. Mr. Battle, thank you again for joining us and being quite honest with us and frank with us about your feelings. You mentioned that this was another stop in your journey in the VA. Tell us, in those years, what have you seen in the journey for the VA medical system?
Sure. Well, first thing you all know, I'm an engineer by trade. So I started out as a project engineer in the VA. And one of the first projects I worked on was converting 36-bed open wards into 4-bedroom units. So that was in 1983, but coming from there to present, now we do almost 90% of all our surgery on an outpatient basis. And that technology has allowed us to do that. So it's been amazing to see the changes in that 32 years.
Wow. What about, I think recently, maybe the partnering with outside sources? How does that weigh in to serve the veterans?
Well, the VA has had a fee basis work, which is work that we have done for veterans in the community for many, many years. Now there's an additional layer with that called choice. And so it's to give veterans more opportunity to seek care on the outside when we can't provide it in-house within a timely basis, or veterans live within outside 40 miles from a VA point of care.
Okay, we get a lot of questions in our office about the choice program. They bring in the letter and say, what does this mean? And we explain it the best we can and say you need to call, see if you're eligible.
Sure.
But on that, we do have veterans here in Polk County, and we're kind of a rural county, and we have the Lakeland CBOC, which is within 40 miles of most of them.
Sure.
But if they can't get the care that they need, or what they need is something that would be at James A. Haley. Have you seen anything, or do you have any suggestions on maybe helping the veteran with the choice program? Because they are within the 40 miles of the CBOC, but
right.
The CBOC may not do what exactly they need, and they still, they're still kind of required to do the James A. Haley.
Yeah, the choice program was initiated last year by Congress a little over a year ago, and the law was written and passed very quickly. The VA was given a very short timeline to implement that law, and I think over the past year we've all learned that there are some parts of that law that could be better written. And so it's my understanding that Congress plans on making some adjustments to the Choice Act to make it more user-friendly for veterans.
Right.
That would allow them to possibly get more care on the outside if it's convenient for them to do so than the way it exists today. And from my view, whatever helps our veterans get the care they need is what we ought to be doing.
Yeah, but we're still a huge entity, a bureaucracy. We're controlled by Congress, and
sure.
So I know there's frustration there for you.
Well, for us, it's trying to take the laws that are written and implement them to the best extent that we can, and we've been doing that. The VA has a third-party administrator with the Choice Act that administers that program, not the hospital. And so, working with them has been some growing pains and learning how to navigate that. But I think it's going to get better as time moves on.
Right. Well, it has to. Let me ask you a little bit about your family.
Yes.
I know you were sharing with me earlier a little bit about your family and the military history. Tell us that.
Well, my father is a veteran. Korean War veteran, served in the 1st Cavalry Division, and he was very special to me, and learned a lot from him. I keep his picture on in my office to remind me about what's important as I do my job every day. And so for me, I really appreciate his service to the country, and it's helped me be the person I am today.
That's great.
So.
I'm happy for you and for your father. Back to a couple things that we mentioned before. You talked about the telephone system, that you want to get that better. Is that because there's so much time waiting for somebody to get to the phone, or is it more phones that you need, or more personnel?
Yeah. Well, sometimes when our veterans call in, it takes a good while for the phone to be answered, so we need to improve upon that. We have our scheduling office where people call in about appointments and things like that. Usually we answer those calls within a minute or so. We'd like to do that in under 30 seconds, where our veterans don't wait. Sometimes our veterans are calling in to get to a particular clinic or provider, and sometimes they get voicemail or things like that. And so what we want to do is just make an overall improvement that when people call in, that they actually get to where they need to get and get their questions answered and their needs met, whatever they are. And we want to do that in a timely fashion for the veteran and not waste their time. So that's something we're looking to improve.
When a veteran comes into my office and we call, I'll call for them for eligibility or whatever questions, and
Sure.
sometimes sometimes it is a challenge. Sometimes we go right through. I guess it depends on the time and all that.
Time of day, volume that's hitting us at any one particular time can impact that. So a lot of reasons for it, but we want to be more consistent with it.
Right. We talked about parking and things like that. We do have a bus that 3 days a week will take veterans from Polk County to the James A. Haley Medical Center, and we found that transportation is a major problem, and that works out great. We've only had that for a couple months, but they will pick up the veteran at a certain location.
Sure.
And take them to James Haley, which alleviates the not the traffic, but the parking and things like that.
Yes, sir.
Now, are you familiar with the DBQ, the Disability Benefit Questionnaire clinic that is in existence, where a veteran doesn't have to go to a private doctor? They can go to the James A. Haley DBQ clinic. Are you familiar with that since you've been here?
Well, I'm familiar with DBQs. I'm not familiar with a DBQ clinic.
Okay.
I know, for example, though, if a veteran needs a DBQ questionnaire filled out, our providers will provide that service to them and do that. What they may very well have to do, though, is we will want them to try to schedule a special appointment to come in and do that.
Okay.
But any of our providers can do that for a veteran.
Okay. I know in the past, we were told that the VA doctors would fill out a DBQ, and many times the veteran would go and they would say, "That's not my job, it's a DBQ clinic," or something like that. And if we have that available to them, then that would quicken our claims processes, I believe.
Well, what I would want to know, if a provider tells our veteran they don't fill out that form, I'd like to know about that, where we can do some re-education or whatever's necessary to take care of that situation.
Okay. I want to ask one other question. You were mentioning earlier a philosophy of yours about earning respect. Tell us about that.
Well, for me, I believe our veterans should always be treated with honor and respect. And in other countries, they give out titles like knights and kings and queens and such. In our country, we don't have anything like that. But there is one title you can earn in this country, and that's the title of veteran. Nobody gives it to you, you earn it. And I believe our veterans should be known as veteran and use the term veteran in their presence and as a statement of honor for them, because it is a title they earned. And to me, that's very important. It's part of our making sure that people feel honored for their service to the country.
Well, Mr. Battle, we're going to wrap it up, and I want to thank you for being with us today and telling us about your thoughts and helping veterans at the James A. Haley Veterans Hospital.
Well, thank you. Appreciate it.
Okay. For more information about James A. Haley Veterans Hospital and Clinics in Tampa, look them up on the web at www.tampa.va.gov or give them a call at 813-972-2000. That's going to do it for this edition of Today's Veteran. I want to thank our guest today, Joe Battle, Medical Center Director of the James A. Haley Veterans Hospital and Clinics. Most of all, I want to thank you for joining us. Remember, for help and information regarding claims, benefits, and services available to veterans and their families, call the Polk County Veterans Service Office at 863-534-5220 or log on to the Polk County website at polk-county.net. I'm your host, Tim Kirkhart, and we'll see you next month.